your gut is causing your anxiety. That might sound a little far-fetched, but hear me out. Perhaps you've heard of the gut-brain connection. If you haven't, it's extremely well established, so it's nobody's opinion that your gut and brain are very interrelated. Let's start with this story. A patient who has had anxiety. Well, she's been medicated for 20 years. She's in her 50s, but she's been anxious for as long as she can remember, her entire life. And she's like, I don't know, I think it runs in the family. I think it's genetic. I've been medicated for 20 years. I also take sleep medication, and she's pretty miserable about it. But that's not why she came to see us, actually. It was for a different reason. And that was sort of sometimes people have things that they're so convinced they can't do anything about that they don't even mention them. And we try to do a very, very in-depth history. And so we find out some of these issues, symptoms, conditions that they're so convinced there's nothing to do anything about. I just take my medication. It doesn't work great. I don't sleep great, but there you go. So that was her situation with her anxiety that had been medicated for 20 years and basically a lifetime of anxiety. If you have anxiety, you know how miserable it is. And miserable doesn't even do it justice. And what happens? You just can't relax, And this patient was saying, this was about 2 weeks ago, she's like, over the weekend, I was just sitting at home and I was watching a movie. And she said, I was just kind of like, what's different? What's different about me? She goes, I was at ease. I was relaxed. And you'd think, well, of course you are, aren't you? Always when you're, sitting on the couch, your feet up, it's Saturday night and you're watching a movie of your choice. No, she was never relaxed. So this was a big breakthrough. And what the real breakthrough is here is that the medications in the main, well, first of all, they have very dangerous side effects, psychiatric medications, but they're not getting to the root cause. And what we find again and again and again is an unhealthy gut. In her situation, she had chronic constipation her entire life. So you go, okay, constipation, you're not pooping and you're anxious. How could those possibly be related? They absolutely are. So what happens with poop, we can say stool, let's just say poop, is that it's supposed to pass out of your body once to twice a day. Nice, big, easy bowel movement, at least a foot long. And some of you might be going, wait, my body doesn't do that. You're in very good company if you're constipated. Unfortunately, you're in unhealthy company. So what happens is this is how the body gets rid of waste that it doesn't want. But there's more to it than that. When your colon is moving slowly, when you're having hard bowel movements, you're not having them once or twice a day. They're not easily passed. What occurs is that bad bacteria, bad microbes in your gut are happily reproducing. So the bad guy, good guy ratio gets skewed. You're also more inflamed, which can lead to a lot of conditions. We're just focusing on anxiety right now. And the other very interesting thing that happens is that hormones get recirculated and they alter. They become, as I used to say to my premenstrual women who are having premenstrual syndrome, PMS, lots of cramping and heavy periods and also anxiety and irritability. It's when you're constipated, the hormones turn into the evil twin sister hormones when the stool is not moving through the way it should. And it's no different for men. Okay, this is the same. So there's so many repercussions of being constipated that affect your mental health. So here at Root Cause, we're looking at the whole body. We know there's an underlying root cause of everything. And you have to understand that interrelationship. So if you've never heard about this correlation before, if this is you, if this is someone you know, and as a quick caveat, I do want to define constipation. I mentioned it earlier, but too often patients, you say, oh, are you constipated? They go, no. And then you ask the next question, well, how often do you move your bowels? Every 2-3 days. Oh, that's constipated. Oh, it is? It's not dinner time conversation. And so a lot of times patients just don't know what the definition of constipation is. Also, there's what's called incomplete evacuation. So you've moved your bowels, but you don't feel like it's fully been removed. You know, there's a little bit left, that feeling of not completely evacuated. All of those are aspects of constipation. So if you're anxious, you know somebody who's anxious, please share this video with them, because it is really critical. There's way too many people on way too many dangerous psychiatric drugs. And by the way, I didn't tell you the best part of the story, which is that after 20 years of being on these medications, she's off now. So she's about 10 days into it. She's like, I can't believe how different I feel. I hope you found this video helpful. If you want more on this topic and others, click here.